Okay, well, it's 9:04. Why don't we let's get going? It's September 4th, and it's going to be another heat wave for the next couple of days in Oregon for everybody in Oregon, because I lose track. I think the majority is still in Oregon, but who knows where, and some might not be. And we're getting more people joining the team, so it'll be interesting. This event will be recorded, and if you have concerns about that, please contact the webinar host, which is me or Kayla or Kelly or anybody from the webinar team. So go ahead. Kayla is running it, so let's start with the agenda and see where we're going. Um, okay, this is our agenda for the day, and welcome everyone. For those of you new, these webinars are every first Wednesday of the month from 9 to 10. And we talk about anything MOTS or roads, because everybody's aware, of course, that we're in the transition period at the moment. But there's still some MOTS things going on, and we always like to talk about that. And if you have any questions, we leave this floor open because we enjoy all your input. So let's get going with the MOTS team and introduce everybody for those of you who are not familiar with everybody. And there we go. Kayla, our MOTS system administrator and future roads PO, product owner. And those are different terms for kind of like the same job, although the product owner sounds a little better like you own this thing. So administrator sounds a bit boring. So I like this. Cecilia, mod support specialist, finally back from a nice, long, well-deserved vacation to faraway places, but glad to have her back again. Myself, senior systems analyst, and ODE, the Oregon Health Authority data environment, formerly known as the Behavioral Health Data Warehouse product owner. So I'm also a product owner as well. And Mary, our second mod support specialist, together with Cecilia, always there to help you and step people through everything. Jody, our EDI technical expert and Rhodes product co-owner with Kayla. Anything EDI, and that's why this webinar, we focus 1 month, we focus a little more on the portal and on the client entry tool from the MOTS system, and the other month we focus a little more on the EDI part of it, and we always call this the Jody Kramer show. So you'll see and hear, you might not see her, but you'll hear her a lot during this meeting. Justin King, MOTS support specialist and research analyst. He knows everything data and how to get to it, if the tools allow him, because that's his only limitation. The certain tools don't always do what get the information that we're looking for. And Anna, who's also a MOTS report specialist and a data analyst. So that's another one for the team. And Kelly, who is our MOTS and Roads communications analyst. She helps with all the things wonderfully on how to communicate better with everybody. Excuse me. Okay, the next slide shows why we do this. I'm assuming, yes. And you're probably all familiar, excuse me, why we do this, to give any changes and upcoming changes about MOT system, road system, what's happening, how are we doing, anything that needs to be changed, or anything that's happening in the behavioral health world that has an impact and an effect on the systems that we're currently running. So any data issues that pop up, sometimes things change in the system or certain things happen within the community, and they kind of cause an issue with the data that we haven't seen before. This is the perfect platform that we use to discuss, educate people, learn from people. It's a wonderful place to do this. Get your feedback. The nice thing about Teams, it's a lot more inclusive than the previous tools we've used, and you can just raise your hand and we can open your mic, or you can open your mic if you can find the button. But it's on the, for me, I have to say, it's on the top right. I not really looking at many other ones, but I think I have the latest version. So on the top right, there's all these buttons but don't click on the leave or the share. The next one for me is the mic. So if that is with the majority, I'd love to see a thumbs up from people. So because if you go a little further, you can have react. There's so many nice buttons on this, but these things are very helpful. There you go. I think I'm the right one. I'm on the right track. And wow, it's so good. Anything that you would like to discuss in any future webinar topics, and that I'm pretty sure that will happen with roads. MOTS is an established system. We've been doing this since December 5th, 2013. So that is almost 11 full years now. So there's not that much changing and not that much that needs any specification, but the road system will definitely get that. And if you notice something or if you're struggling with something, please let us know and give us ideas or issues, items to talk about during our webinars. And if we can, answer any of the questions that you might have. This is also the perfect place for it. So, Kayla, next. There we go. There the microphone goes to Jody. Road system launch. It's happening. Yay.
Yes, absolutely. Yes, thank you. Welcome, everybody. Nice to see all of you here. Yes, we have a date. So we are going to be going live on December 16th, as you can see in the bold there. Yay, we've hit the finish line, or at least a major milestone. So we're putting some final touches on things. We've got security features and some other functionality. We're right now going through what we call user acceptance testing. Some of you might have heard UAT testing. That's our OHA team actually getting into the system. We're running EDI files through. We're kind of pegging it to make sure that everything's running smoothly. So yeah, and as the slide says, EDI refinement is definitely been underway, making sure that when we go live on the 16th, we will have a smooth transition. And we really do appreciate all the continued support, the positive feedback, even the constructive feedback that we've received, because we were trying our hardest to give a really top quality solution that will definitely hopefully reduce administrative burden, streamline reporting, and all of those things were on our list of things we wanted to hit. So what I will say for all of you, because this is an EDI webinar, that be on the lookout for some training dates. Those will be coming out soon. The training for you all is going to look a little different than like the full-on portal users who enter data that way. But you're going to get a training tailored to EDI folks that's going to talk about the portal, the new features we have available in there for you to actually be able to see more information on your files, what were errors, what weren't. You're going to also be able to have access to some dashboards. Similar information that you get in some reports that come out like once a month. But now you'll still get your reports, but you're going to be able to go to that dashboard, have some nice widgets, be able to look at things. Um, so that's really exciting. And on top of that, you will actually be able to drill down to your client that has been submitted to the MOTS/road system and be able to see like all their episodes of care that you've submitted, all their crisis, all of whatever's been going on with the client that you've submitted to us and we accepted. And the cool thing is we are importing all of the MOTS data into the road solution. So you will have visibility to data that has been submitted to MOTS in the past underneath your clients. So we got a lot of exciting things coming. So if you could just kind of, I know we're going to be approaching in the holiday season, right, in the midst of it, but just keep your eye out. We'll be letting you know. For you all, when we do go live, as far as your files go, you're going to just keep submitting them like you do today. You just put them into the SFTP or your system does it. You'll still get a results file like you do today. So those things will stay the same. That should be a smooth transition. But the exciting piece is you're going to be able to have access to a portal that has tools that you can actually use and see more of your data. So more to come, but we just are, as you can tell, I'm a little excited this morning and I haven't had that much caffeine. So it is sheer excitement that we are going live super soon. And oh, hey, I see a hand went up from Alex and another hand. Super.
Hi, yes, thank you. This is
Hi.
Alex. So I'm with Whitebird Clinic in
Uh-huh.
Eugene. Just a quick question about like the integration with various EHRs and how that process is working. We're on CareLogic. I know that last I heard from them, which was a couple months ago, they were still waiting on, I guess, specifications from you to build out the roads piece. So I just wanted to ensure or check in on whether those integrations are going to be in place prior to the December 16th or not.
No. Okay. So first off, CareLogic is correct. We have not posted out what is going to be considered the roads EDI version 2 yet. So that we are hoping is going to be like in the next 30 days. I told somebody yesterday, I feel like a little bit like the boy who cried wolf in the children's stories because we've been moving the dates along. Um, but essentially, when we go live with roads, we are just anticipating and expecting that your existing MOTS files will continue to come into the roads solution. We're calling those MOTS legacy files the version 1 file. So once we go live, I'm probably guessing 95 or 99% of you will all be continuing to submit your files like you have been, version 1, we're calling it now. Once those documents are released, we will start working more tightly with the EHRs and your teams, the collaboratives that they put together, so that we can assist with any questions they have on the expansion for version 2. And just so all of you know, version 2 is built literally on top of version 1 in the sense that we did not recreate the entire file structure. We didn't change like the header, the footers, the delimiters, all the things that make the file. We didn't change the data segments. So what they have built prior will be able to be built upon to add what the additional values are that we're going to be able to collect now in roads. And they'll also be able to sunset the ones that we are no longer collecting, which that's really a very kind of small handful. Um, we have been in touch with CareLogic. We've also been in touch with Dr. Cloud, Ocean, Credible, Reliatrax. And so we know that there is going to be some development time that's going to take to spool up. So anywhere from 3 to 6 months, or excuse me, 3 to 12 months is what we're anticipating, depending on which system and things like that. So they definitely have been plugged in with us, and they are waiting on the specifications document, but you're going to go live with what you're doing today. So for anybody who's switching EHRs or upgrading or doing something like that, continue to build out the MOTS piece of it, because the V2 will be built on top. I hope that made sense. I see Christy's hands up.
Yeah, hi. So I know you're working on like the EDI specification documents. Do you have something? Because obviously you guys know what the fields are that you're collecting and um, what the proper responses to those fields are going to be for roads. Do you have a document like that so that we can look at it and start doing it? Because I'm guessing we're going to be building our own. We use
Yeah,
Evolve,
yeah, yeah,
um, and so we've decided we want to start building it. So for us to be able to see what the fields, what the stuff we're collecting is, and then work on the EDI collection field or file
yeah.
separately. So is that available? Is that on the website somewhere and I haven't found it, or where can I
No,
find it?
no, 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 no. It is not available. We have not been authorized by leadership yet to put out any of the documents, but we will take this back to our leadership. We do have a leadership meeting today, and we will ask like where we're at with this, because I know there's a number of you that do in-house development with your IT teams and whatnot. And so what I will say is the biggest things we've added to the roads data collection is Real D. We've added the stabilization services, it's kind of for kids and maybe young adults, mobile crisis. And then we added a few other fields within the normal behavioral health and the addiction segments. Those new RealD, the ones that I mentioned, we are using specifications documents from like the Office of Equity and Inclusion that does RealD. We're following their .csv file requirements. And we also, for stabilization services and mobile crisis, we've gotten that from in tandem with OHSU and because they're collecting it now, and the program staff here on our team, our business analysts. So if you've been reporting out to those kind of things in that manner, those will be similar ones. So that isn't a good, like, yes, we have them and we can give them to you. But I'll take that back, Christy. We'll find out where we're at, what we can do, and then we'll send something out to let folks know. Oh, and the other thing, Christy, is, and others here, so the fields that we are keeping, right? So like last name at birth, all of those kind of things. That's not a good example. Like say county of responsibility, that's a good one. Where there's numeric values that you put in and you map over for the file. We have left those the same between version 1 and 2 if it was an existing field that was in version 1. So we didn't want you to have to all remap stuff. I'll pause now.
No, that's a good idea. I think Thomas still has his hand up.
Yep. Yes, Thomas.
Yeah, hello and good morning. I'm with Dr. Cloud, and the big concern we have is that if the roads, aka version 2, has more real D fields and that type of thing for reporting, can we at least get a layout of what that should look like so I can take that to my developers and we can start incorporating that to be ready by December 16th for reporting? Because right now, all we have is the original MOTS as it's evolved over time. We haven't included anything for RealD yet because we've still been waiting for things like the data dictionary. Now, I understand that's not your fault because you've got other people who keep pushing back saying, not yet, not yet, not yet. I completely get that. But that kind of puts us in a bind because that impacts so many of our clients in the state of Oregon. So it's kind of a hot potato for us.
Sure. Now, we do not expect you to have RealD ready on December 16th. So what I mean by that is the EDI documents that will be coming out for all of you, especially the EHRs will be, real interested in them. RealD is going to be a reportable set of data in version 2, but we know that it's unrealistic for anybody to, well, for most, to have version 2 spooled up by December 16th. Like, that would be pretty amazing. So I'm not sure, are you worried that your clients won't be able to report by December 16th and they'll be out of compliance or something like that? Thomas?
Partially.
Okay.
So what it is because we have an automation for MOTS reporting.
Correct.
And we want to make sure that your and our mutual clients don't get called to task because there are errors due to data missing because it wasn't reported in the first place, because we didn't have a spot to allow them to put in that information to try to make it as accurate as possible.
So the RealD is going to actually be a segment of data that's allowed to be sent for a client. So when you're sending like a regular episode of care for, say, an addictions client, you're sending the client profile details, the behavioral health details, and the addiction details, right? With that submission, you're not necessarily sending a full RealD at all. The gender and the race and ethnicity fields that would come traditionally with that reporting. What we've done is we've aligned those fields to match what the full body of Real D would ask for. So they're in alignment, but that episode of care isn't natively going to have all the Real D elements in it. Does that make sense?
It does, but at the same time, I'm sorry, but visually I have a disconnect. So there's
That's
the
okay.
information that we collect and we send to you, and you have it mapped on your side to say, okay, this block to this block, et cetera, et cetera, et cetera. And then if you have gaps, like for the SOGI, for example, because currently we're not collecting that, then how do we fix that? Unless we have some type of a layout to say, well, we can include these data points in each
So,
segment as needed to help with that reporting. Because otherwise, from my perspective, you're inadvertently creating a data gap, and it's on my client's side to get that correct.
So
I'm
what
just,
we can do, Thomas, is we can send you a link or put one in the chat here to the document that we've utilized from the Office of Equity and Inclusion to look at, because that's a public facing document that's been published. And that for all the 60 to 70 Real D fields is what we used. Would that help?
that'd be extremely helpful. Thank you.
Okay. All right. Now that I mentioned popping that in the chat, I don't know if Kayla's got access to the link.
Well,
Kayla's really.
I just tried to get there, but I'm sharing my screen and I don't want to have to look
Okay.
for it in front of
Well,
everybody. But I will get it in there.
Yeah, we'll get it in there. Yeah, Kayla's really taken the helm on the Real D. I definitely do, and I want to take credit for all of the hard work, because it's a big body of information, as Thomas is. I think that's expressing, you know, with the concern behind that. So, so we'll pop that in the chat here at some point, and then Thomas will also follow up with our leadership today and Christy to see, you know, the what we can do to try and get a window of time here. So, okay. And I appreciate you speaking up, because it gives us something to go back to our leadership with as input.
Thank you very much. So I think it is appreciated.
Thanks, Thomas. Thanks, Jody. And Real D SOGI is a bit of a different animal than all the stuff we've had. So, okay. What was the next slide? Because I think we got everything. There's still some stuff going in the chat. The next slide is, guess who?
That's me.
EHR file prep, Jody Kramer. You think you're ready for it, Jody? Or you need a sip of coffee?
Yeah, I got some tea actually, but it is got some caffeine in it. So, one of the things that we have had is we've had some new EHRs coming to us, and wanting to look at developing, you know, EDI. We've also had other folks switching systems and wanting to know, well, hey, we're going to, you know, EHR XYZ, and they have their MOTS all set up. Should we even bother with, you know, going down that road, since we're so close to, didn't mean to do that, but we're so close to roads going live. So the answer is yes, because as they develop and build on the MOTS, you know, what is there today, that is the structure and the backbone of what version 2 is really is. And so if you are switching to a new EHR, or you're, you know, wanting to spool this up, continue with setting up the MOTS, because all those files are going to continue to come into the roads system. Some of the, like I said, it could take, you know, 3 to 12 months to get these things spooled up. So even if EHR XYZ, if you're good and ready to go live here in a month or two, we don't want you not reporting for like 12 months. Like we would probably then say like, well, you're probably going to have to input through the portal by hand, and you probably don't want to do that. So we just want to make sure that, all files will be pushed into Rhodes upon go live from the MOTS system. So definitely make sure that you're doing that. Otherwise, you might have to utilize the portal to ensure you're in compliance.
Thank you, Jody. Kathy, you had a question?
And I found my mic button.
Nice.
Just to understand, I am also from an EHR. I'm from Next Step Solutions. So
super.
as far as planning, are you going to be rolling things out over the 3 to 12 months, agency by agency, or are you going to work with EHR system and then another EHR system? I kind of want to get a sense of where I should put it on our calendar. If client A is going to be on the early end and client B is going to be on the late end, just making sure that I don't get behind the 8 ball for anybody in terms of when we're ready. Like if
Sure.
it sounds like everything will be fine for people now if they're comfortably using MOTS now, and that there's a pretty good migration path. But in terms of scheduling the work for when I need to get ready for the next bet, who should I be talking to for driving that?
So probably myself or Kayla. Pete's also my backup. He doesn't mention he was the original Pete show, and I took over. Anyways, so our thought is, because both Pete and I were here when MOTS spooled up 10 years ago plus, and so what we're going to do is publish the documents, and then we're not putting any fencing around which EHRs can develop or bring stuff in. We're going to put those documents out. We're going to, offer them to have some follow-up once you've had a chance to ingest it with your team and looking at it, right? And then basically there isn't one EHR goes first. You basically all can start looking at the documents, figuring out your, scope of work. You can figure out how long it's going to take, communicate with your clients and us. So we got a barometer of when you think that dev window is. Then there'll be a certification process like we do normally with files. So once you and your clients are ready to start getting your version 2s certified, then we'll add that data submission method. We'll put the things in place to allow your files to come in and get certified and that will happen during the dev time too, I suspect, Kathy, like, you want to check things out. So there is no corral for certain EHRs. We're just going to be like, here's the docs, and we're going to make sure that myself, Kayla, Pete, others. We have another junior product owner coming on board with Kayla and I, but we'll make sure that we've got the resources to support whoever's doing what at that time.
Okay, thanks.
I saw somebody popped a question in the chat. And it's from Sandra. She says, hello, since we are not certified with OCHI and Epic to send our MOTS, are we considered out of compliance? We are in process, but it has been since we have transitioned from next gen to Epic with sending MOTS to you.
Okay, so Sandra, I think you're with Lane.
Yes.
And so we know that when you go from one EHR to another, that there's typically, a window of time that it's going to take between the one to the next one. We could probably, technically, you're all supposed to, there's certain reporting thresholds that you all should be reporting by, like new admissions within 7 days of them happening, updates every 90 days at a minimum, crisis and voluntary services should come in 7 days after the date that is identified. So, I think it's kind of one of those things that I wouldn't really have the proper answer for, or our team wouldn't, as far as like compliance goes. But our program teams and our certification licensing and so on and so forth do work with us to kind of get a pulse on what's happening with things. So if you have any questions about that, I would take it back to your group to say, hey, should we check into this, or what should we do? And we'll be happy to share with whoever that individual is at OHA to talk with you about that, where you're at and what you've been doing.
Okay, I was just informed by my supervisor Katie and Debbie Curry if I could get with you after the meeting when you have a minute. And yeah, we need to discuss barriers that are coming about with the with the process. So if we could spend some time on that, I'd appreciate it.
Yeah, gotcha. I will after this, I think I got another something right after, but I will send you some availability points, and yeah, let's connect.
Okay, thank you.
Yep, sounds good.
Thanks, Jody. Thanks, Sandra. And the next one, I think it is Jody Kramer.
Yeah, I looked and I was like,
FAQs.
wow, I got a quad pack here.
Next time we'll
sorry about
that,
Jody. We'll mix it. I'll do better next time about mixing it up.
No worries. Just hope everybody doesn't get like tone deaf to my voice. So
it's already turning into an FAQ session, so that's good.
Yeah, exactly. Yeah, just up on it. So we got this from some folks when we got some feedback, and so one of the things that we're really trying to work through is some of these points where with the EHRs, clarifying, batch report statuses, differentiating like system and reporting go live dates, because, like we're saying, hey, we're going to go live on the 16th of December. Super exciting. But like, what does that mean? Like, for your system and what you're doing. So kind of like, are you doing MOTS version 1? Are you doing version 2? That kind of a thing. We also have, been trying to improve the communication in newsletters. We're trying to also take the feedback we're getting from you. That's why it is really important to provide us with, constructive feedback, even if it might seem negative. We'd still like it in a constructive way, so that we can share that to the different up or downs that needs to go. And we are planning the engagement with EHR user groups. So like, I think it's credible that we currently have a standing once a month like deal that we always meet on. But as you get it, which is always available to any other EHRs that want to do that as well, just for the record, they're not exclusive to Credible. If y'all want to have a user group with MOTS on a monthly or bi-monthly or quarterly or whatever, we're happy to plug in and help you with that to facilitate with your MOTS users / roads. But we do know that once we get into the development of your version 2, like a few of them have said like, hey, we're going to create a kind of a collaborative for this targeted project. We're going to, ask for different beta users. So like your EHRs will start doing more, and we will be plugging in and making myself and or somebody on the team available to see that through, so that as they have questions and they have things, they're not waiting on us. So I will have to say, like, I think from what I've heard from most EHRs is that we do better than sometimes others for making ourselves available to their process and answering their questions. So we're going to be engaging tightly with you all. So I'm actually kind of looking forward to it, because I really do like working with all of you individually. And so it'll be fun to roll into this piece of it. It'll be work, but it'll be fun.
Excellent.
That's that.
Thank you, Jody.
Yeah, cool. I think I got one more.
One more. Yeah.
I'll breeze
and then we'll give you a little break. So I think Kayla and Kelly are coming up after that. So
yeah,
keep data up to date. Well, that's a good one, of course.
So we really want you to try to get your data as up to date as possible prior to the roads go live. And what I mean by that is, if you have a bunch of clients that haven't been updated, and you get an active client monitoring report, the providers do every month at the beginning of the month. If you've got a bunch in red, or you've got some that are, yellow or orange, like let's take a look at those and see kind of where your data is at, because the cleaner it is going into the road system for current up-to-date reporting, the easier I think things will be. It'll be less technical debt and other stuff that we can all try to avoid. So there hasn't been any changes to the reporting cadences. I kind of blurbed out part of that a few minutes ago. And if you do have access to the portal for MOTS, please log in. And this is also going to help with, we're getting licensing, and because our new platform is in the cloud, and in the government regions, like we have different licensing and different new requirements, which you'll hear about for logging in. So if you log in and keep your current access to MOTS up to date, we'll make sure that your MFA is working, which Kelly is going to talk about. It's going to make your transition into the road solution much smoother. If you don't have access to the MOTS portal and you're not sure what that is or why you would need that, you can email us at MOTS support, and we can, because we're going to want at least one and a backup, ideally for each organization, to have access to the road solution. That's kind of what we wanted with the MOTS, but there isn't as much to use in it. So, but for the new system, that's what we're going to be looking for. So if we can get you set up and plugged into that access point before the 16th, that would be great.
Excellent. Thank you, Jody. And then it is time for Kayla. Changes to Citrix. That happened as well, of course.
Yes, Jody can have a well-deserved break after all those slides. I am going to talk about Citrix really quick. So some of you may be familiar with our old Citrix platform that we had asked folks to log into in order to register your account as active within our internal state system called Active Directory, because MOTS is not related or not connected to Active Directory in that way. Well, that option has been discontinued. Our technical unit has opted to do away with that Citrix. They're now using a different one, but the new one is kind of obsolete for our users. What has changed, though, is our password resets. Before, password resets had to happen through Service Desk. Now, users can reset their own password, but you will need to have registered for MFA before you're able to do that. And we have I think the next slide is our MFA slide. So if you're not familiar with MFA, we can tell you a little bit more about that. But we will have this self-service password reset link on our website. We'll have it in our newsletters so that it's easy to find. Kelly just posted it in the chat. Thank you, Kelly. And so this will be used with your UPN, which is your state email. And if you don't have that, let us know. If you have a P number, you do have a UPN. Before this change happened, or before MFA took over, the MOTS support team never really had a reason to share your UPN with you because it wasn't needed, and you didn't need it to get into MOTS. But we will need it for MFA and for roads. So if you don't have that UPN, which is it's what our state emails look like. Like mine is kayla.cameli@oha.oregon.gov. Your UPN will look something like that. So if you need to configure MFA, you will need a UPN. And if you don't have that, just let us know and we can get that for you.
Excellent. Thank you. I saw a question pop up about what is the purpose of the MOTS portal. The MOTS portal is a web-based data entry tool for individuals who are not using an EHR or have an EHR that does not communicate with our system. There is a way to log in and enter your client information manually. That's what the MOTS portal is for. And that's why there will also be a roads portal, but the roads portal will be a lot more comprehensive because it will also be used for EDI individuals who want to look at their data, what has been entered, and there's all kinds of nice dashboards and stuff that our contractor is building for us and for you guys so you can see your data. So Okay, I hope that is enough information. We have MFA. Kelly, it's up to you.
Yes. Good morning, everyone. Multi-factor authentication, my favorite topic. um, so many of you, I am sure, have encountered MFA through, your banking apps or doctor's office or, anything like that. It's just that extra layer of security to keep sensitive data safe. So now it has come to MOTS and roads. And so all providers will need to configure MFA, and you're going to need that state email address, that UPN that Kayla was just talking about. That's your user principal name and your password. You're going to need to have that handy. If you don't have that, don't know that, please reach out to us. We will get that to you. Then you will need to choose how you're going to authenticate. You can use your smartphone with the Microsoft Authenticator app, which is our recommendation. It's just a lot easier, and it's just that's our recommendation. Or there is the option of using a YubiKey, which is a physical hardware token that plugs into your USB. You will also have to download an app with that onto the device that you report your data. It's a little bit more of a cumbersome thing because you have to have whatever device you're using, you have to download that app and then carry your little YubiKey around. So we do recommend, if you are going to go the YubiKey route, to use a Series 5 YubiKey, and we can get you some information or answer any questions if you want to know more about that. We have also created 2 step-by-step guides to walk you through the MFA process. There's some steps. It's definitely a bit of a process. So we have that, and I'm going to pop that in the chat. But please reach out to us if you have any questions or get hung up at any step, because we are here to help you with that. And yeah, thanks, Pete. I'm going to pop those links in the chat.
Excellent. Thanks, you, Kelly. And the YubiKey, another issue with why we recommend the phone is that it only works for the laptop or desktop or mini, whatever you have it installed on and plugged into. So if you happen to work on multiple workstations, then you have to need multiple YubiKeys. So that's why we say, well, if you have it on your phone as an app, then it's so much easier, because then you can log in somewhere else, or if you work from home sometime, or you work offsite or different facilities, different locations, it is all a lot easier that way. So it took me a little while to kind of go for it, but it definitely is. So, okay, that was, and guess, Kayla, back to you. Intro to MOTS. Ooh, intro to the MOTS team. Close enough.
Yeah, I'm sorry about that. That link was not working. Let's get the intro to MOTS one. There we go.
Yay.
Perfect.
Oh, sorry.
Okay. That's okay. Our intro to MOTS, our next intro to MOTS session is next Wednesday at 10 a.m. And this is really geared for folks new to MOTS, whether your whole agency is new to reporting to MOTS, or you are in a new role at your agency and have assumed the responsibility of supporting MOTS data submissions. This webinar is really a MOTS 101. We go over kind of how MOTS is structured. We are going to briefly go over MFA again in there to make sure folks know what's going to be needed for that in order to access MFA and change passwords and all that fun stuff. We also are hoping to provide some kind of demo in our train environment for MOTS so that you can see the system and get a little familiar with what the field's like and how to navigate. I see a question in the chat. Is MFA going to be required for roads? And the answer is yes. So upon roads go live in December, actually it'll be pre-go live, because you will need MFA to access the train environment as well. So likely November late November, maybe mid-November, we'll start talking about training, and we'll have a big push to get everybody who has not configured MFA by then to jump on that state bandwagon to get that configured. But the intro to MOTS is next week, 10 a.m. We look forward to having folks join if you want to learn a little bit more about the background of MOTS. If you're a MOTS pro, don't worry about attending. It'll be stuff you already know. But if you want to know a little bit more, feel free to join us.
Excellent. Thank you, Kayla. And then it's back to Jody, switching from CE to EDI.
Yeah. Yes, thank you. Yeah, basically we just, we cover this every time, but it's always a good reminder for, anybody who may be considering this and maybe tune this out on one of the other ones because you're like, we're not switching systems. So anyways, if you are going to change systems or even upgrading your system, just let us know the change. Notification is number one, most important. If you are shopping for different electronic health records systems, maybe, you usually get demos, you get previews, you get different things like that. And it's always helpful to just maybe ask what the business process is for this functionality. Like, how does it work from client coming into your place to your system, or somebody at your organization submitting that to MOTS? Like, how much staff time will be required? Who's going to do what? There's not any way that's better than another. There's just differences in workflows. So when you're looking at different systems, it's often good to just understand how that MOTS functionality works so that you can, kind of have an alignment, your expectations of who's going to be doing what. So once you tell us you're going to maybe change, then we can talk about your project timing, a process. If you were client entry to begin with and you want to go to EDI, there's a process for changing the data submission. If you're EDI going to a new EHR, there's no switching data submission methods. You're going to stay EDI, but we're going to set up some new way for you to certify with the new system. So your secure file transfer protocol setup is going to remain the same. Once you get that, it's associated to your agency, and it's you use it regardless of which EHR you have. If you are needing to update client IDs because your new system sends a different one, then we can talk about that and how the process goes for us to update those. Defining your business processes. We have other providers with similar EHRs, and sometimes folks like to connect the dots with one another, network, pass what works good for them using the solution. So we can always kind of align that, because defining those business processes before you go live is super helpful. Testing of your files through EDI, even if the system you're going with is already got, say, 5 users using it successfully, you will still be testing your files, because with all the customization and different things now that all these systems are able to provide for us, we want to make sure that your setup and is going to be coming through as expected. Also, you're going to go live, obviously, and then we'll do some follow-up. And the follow-up is really helpful. It can be, weekly, bi-weekly, whatever. But once you're live, you really start getting the real data coming in. You get your real results files. You get errors. That's normal. So yeah, we offer that to make sure that we can answer any questions. So we've been doing this a long time. It should be, it's pretty straightforward. So you letting us know is the first pivot point to start things moving. So yeah.
Excellent. Thank you, Jody. Back to the agenda, and then we're probably about to wrap things up. Are there any questions? Somebody I saw asked to be registered. I saw something pop up, and Christy has one more question, and this is the Q&A part. So go ahead.
Okay. I would have put this in the chat, but chat does not want to let me do it. So I just kind of wanted to throw this out there for anyone else who may be in the same position as us. But we had been considering enacting Soji and RealD in our system, but then we realized that we wouldn't then be able to successfully submit MOTS files, because the MOTS files are not able to receive that information without some sort of crosswalk or something being put into place. So just kind of putting that out there for anyone else who may be in a similar situation, just to consider that with your SOGI and RealD is when you put that in, you may not be able to use it if you're still submitting the MOTS version 1 rather than Rhodes files. So just kind of wanted to share that with anybody else.
Thank you. Yes, that's correct. We do not, MOTS does not accept it. MOTS currently is what it is, and it will be the version 1 into Rhodes. So if you try to sneak other things in there and you still call it version 1, then the system will say, so, or it should say, and we're testing it. So, and it's looking pretty good so far. So, but thank you for letting us, yes, for that note. That's very helpful. Any other chats? The links, Kelly put the links in there, of course. Excellent. Speaking of links, Kayla told me that the recording of the webinar will be sent. The link to the recording of the webinar, it will be posted, and the link to the recording will be sent with the slide deck. So if you attended this one, we have your email address. We'll send you the slide deck and a link to the recording for those of you who want to review it one more time, or maybe share it with a coworker that you think might be interested in the information that we have, or you're not sure about exactly how we worded it, or they're not really sure, so you want to listen to it one more time. So it will be out there. So. Okay, then we have the list of contact information, the two important ones up top, of course, mots.support@odhsoha.oregon.gov and the roads at odhsoha.oregon.gov. And then the list of Kayla, Cecilia, myself, Mary, Jody, Justin, Anna, and Kelly. And we're all at basically his first name dot last name. Kameli has a 2. She has to be special, of course, but everybody else, first name dot last name, and some have an initial in there, at oha.oregon.gov. Okay, looking at the team, see, did I miss anything? Everything covered in the chat? Okay, I think that was it.
I see one question about MFA being required for SFTP, and I think
Yes.
not
The
for,
answer is no.
yeah, the answer is no for SFTP, but it will be yes for Rhodes, and because Rhodes will have a little bit better interface for EDI providers, I'm assuming you'll still want to access Rhodes, even as an EDI provider. Mm-hmm.
Yep, definitely. Excellent. Okay, thank you. Anything else? Oh, it's perfect timing. We have a couple of minutes left to give back to you. Thank you all for joining, and hope you all have a wonderful rest of your day. Take care.
Thank
Bye-bye.
you. This was good.
Thanks
Thank you.
so much, everyone.
Thanks, everyone. Bye-bye.
Bye.